want not to do in diabetic, and these are the patients which make the almost 10 to 20% of our practice into today's era that diabetics is common in cataract patients. Now we are going to ask Dr. Ashwani KALIA to present hard cataract Phaco new energy saving times.
But we often encounter black and brown cataracts in our daily practice. Most of the eye surgeons like vertical chop and do not prefer horizontal chopping because a lot of force is required to break the hard nucleus between chopper and phaco tip, which can cause nucleus torque, dangling, and other complications. To overcome these difficulties, I devised a new chopper for horizontal chopping, which has unique multiple sawtooths which provide contact at multiple points and chop hard nucleus in a very controlled manner. This 2 millimeter vertical limb and the terminal is blunt. First place the chopper on the left side pointing, then supinate the hand. I am not using any phaco energy or for holding or for any vacuum, just only irrigation. You can see the whitening of the lens fibers because compression forces are applied between the chopper and this phaco probe acts like a shovel. A lot of energy is saved because no trenching and nothing. Even in subsequent chopping also, just I crush the nucleus pieces between the chopper and the phaco tip. No vacuum or ultrasound energy is required. Ultrasound is required only for final emulsification of the fragments. Because the chopper does the job of holding the nucleus pieces because of this 2 millimeter just placing the probe and then crushing into the Another advantage of chopper is that it also acts like a scaffold for the last pieces. It helps in stuffing also, and as well as protecting from fragment from the chattering and causing sometimes injury in during the last pieces. It keeps some control over that also. Very less energy is required for phaco emulsification of these fragments. I am comparing the vertical and horizontal phaco. On the left side it looks like a mature cataract, but actually it is a hard cataract. In vertical chopping, the nucleus pieces are like broken pieces of glass. The hardness of pi of nucleus is same as the original nucleus. Moreover, you can see there is a rotation of the nucleus during this, in this case, vertical chopping. That can cause stress on the posterior capsule as well as zonules. And there is whitening of the lens fibers in the horizontal chopping, which causes softening of the nucleus. You can compare the pieces of nucleus after horizontal chopping as well as vertical chopping. The margins are sharp and the hardness is same, but here the hardness is decreased, so there is less energy, especially with many eye surgeons have lower end phaco machines and we can save the energy. If phaco handpiece or machine goes out of order and OT list is pending, or if eye surgeon doesn't have phaco machine, then attach phaco tip to IA handpiece and do bisection, quadrisection with the help of phaco tip and sawtooth chopper. Horizontal chopping through 2.2 millimeter incision, then remove the nuclear fragments through 4 mm limbal or scleral incision with the help of histoexpression or irrigating wire vectors or McPherson forceps. There is no requirement of vacuum or ultrasound energy for nucleofractus. So this is advantage if Anyone who wants to do SICS? This is just Phaco tip attached to the IA handpiece and irrigation solution. The first step is just like Phaco emulsification. Because there's no option of vacuum or energy for holding, and we can break the nucleus into multiple pieces just like earlier cases. I think this is a new concept. I have not heard or read about this applying Phaco tip to the IA handpiece and doing cataract surgery. Chamber is well maintained, as is irrigation through the side, and then we can remove with the wire vectors through 4 mm or 4.5 mm, implant the lens. I gave the name of Tejas technique to this because both are Make in India projects, and both are super fast in crushing their enemy and getting the good results. I live at Firozpur, that is a 10 km from Indo-Pak border. Take home message: the myth that horizontal chopping is for soft cataracts and vertical chopping is for hard cataracts is not correct. Number 2, energy is saved in this technique, which gets wasted during trenching in stop and chop. Second, 4-quadrant technique, embedding of probe into nucleus during initial vertical and routine horizontal chop and subsequent chops. Due to compression forces, there is softening of the nucleus. Here both the tip as well as chopper move towards each other, so the burden on left hand decreases and hence more safe procedure. While in routine horizontal chop, Phaco probe is embedded in nucleus and only left hand applies all force. High vacuum settings are also associated with increased endothelial cell loss up to some extent, along with high energy. In this technique, no vacuum is required during nucleus fragmentation. Last but not the least, you get the feeling of doing Phaco while doing SICS with Phaco tip and my chopper. Both are Phaco surgeon. Phaco means lens, as nucleus fragmentation is exactly similar in both techniques. Only difference lies in second step of emulsification or manual removal. This will help in bridging the gap between Phaco surgeon and SICS surgeon. After 1 week, no one can judge whether ultrasound energy was used or not. Thanks.